Health promotion in minority populations, Native Hawaiians. The U.S. healthcare system slightly differs when compared to other industrialized countries. In many developed states, medical services are widely accessible for residents, while the U.S. imposes strict insurance programs which are sometimes not available for the low-income, unemployed, and elderly population. Even with the implementation of such programs as Medicare and Medicaid, not everyone obtains equal access to healthcare services. The American nation comprises several ethnic groups, including Black, Hispanic, Asian, American Indian, and Native Hawaiian minorities, most of whom are deprived of the quality healthcare facilities the whites have. For instance, many Native Hawaiians suffer from poor health outcomes, so a deliberate promotion plan should be created based on their cultural values and practices. Native Hawaiians are a minority that was previously included in the Asian ethnic group. However, the health outcomes were significantly different between these two parties, so they were divided into two separate cohorts. Currently, Native Hawaiians and Pacific Islanders belong to the group, but the results of each are usually reviewed and analyzed separately. The current health status of Native Hawaiians is characterized by several poor health outcomes: overweight and obesity, hypertension, diabetes, and high rates of asthma and cancer mortality. Thus, the percentage of those who ever had asthma is 19.6%, which is much higher than the national average of 12.9%. More than 11% of adults aged 65 and over need help with personal care, which is almost twice as high as the percentage among all U.S. adults. Despite these facts, the Native Hawaiian ethnic group representatives were previously characterized as healthy, strong, and hardy people. However, the major reasons for poor health outcomes of this minority result from either genetic dispositions or the intervention of Western nations. In the United States, health disparities evolved among Native Hawaiians because of discrimination and inappropriate access to healthcare services. For instance, the high prevalence of cardiometabolic disorders has been attributed to psychosocial stressors, socioeconomic deprivation, and sociocultural challenges. Among the adults of this ethnic minority, about 4% of them experienced psychological distress, while the national average index is only 3%. Furthermore, after the advent of Western civilizations, there were dramatic changes in land tenure and social structures followed by suppression of the local culture and language. Colonization resulted in historical trauma and the loss of traditional lifestyles, where fishing and agriculture were replaced by a large-scale industrial rural economy. As a result, some nutritional challenges arose because Native Hawaiians could no longer consume natural foods grown on the island. Based on the historical premises, Native Hawaiians faced many barriers to health. Moreover, the expansion and evolvement of traditional healthcare services sponsored by U.S. official institutions were not satisfactory. Native Hawaiians still experience cost barriers, cannot obtain full insurance coverage, and receive a routine annual checkup. Currently, elders of this minority have the lowest per capita incomes and highest poverty rates of all American ethnic groups. Native Hawaiians have been continuously facing economic and acculturation-related challenges that negatively influence their physical and mental health status. In search of better employment and healthcare access opportunities, the representatives of this minority are often forced to migrate to other states in the U.S., Australia, or New Zealand. Those who obtained an opportunity to receive the appropriate healthcare services also encountered misunderstandings with practitioners. Deficiencies in cultural competency, local language skills, and conflicting perceptions and attitudes toward healthcare created a barrier on the way to the quality of healthcare services for Native Hawaiians. Meanwhile, many community members stick to their traditional practices and beliefs in health promotion activities. Native Hawaiians have values similar to those of pagan people who believe that a man is a part of nature, mutually influencing each other. When one breaks the laws of nature, he or she may receive a punishment in the form of a disease. Furthermore, their main beliefs constituted that a man is a holistic organism in which body and spirit should be cooperating in harmony. Hula practices are traditional among Native Hawaiians as they help a person to become complete. A decade ago, scientists from the University of Hawaii and the cultural practitioners of hula formed a partnership to develop and evaluate a cardiac rehabilitation program based on hula. Currently, herbal healing practices, acupuncture, and Tai Chi, brought by Japanese and Chinese migrants to the island, are also prevailing among the local people. The creation of an appealing care plan for the Native Hawaiian ethnic group should be based on the health belief model and consider the socio-cultural and socio-economic realities of the group. As many representatives of this minority already suffer from diabetes, obesity, and hypertension, tertiary prevention is the most appropriate of the health promotion strategies. Its main principle constitutes softening the impact of present illness by helping people to cope with long-term problems and improve their quality of life. Those interventions are supposed to incorporate the principles of the health belief model that helps people to realize the existing health problems, recognize barriers and beliefs, and promote engagement in health improvement behavior. Furthermore, these preventive measures are expected to be the most effective with the incorporation of basic local health beliefs and traditions. When traditional and alternative healthcare practices are combined, this is called integrative medicine. Tertiary prevention based on such an integrative approach for chronic disease is expected to reduce morbidity levels. For instance, nutritional supplements such as fish oil, herbal pills, and mind-body techniques are used to treat type 2 diabetes, while therapeutic diets combined with herbal tinctures can cure hyperlipidemia. If Native Hawaiians recognize and implement such integrative medical practices, the overall health status of the minority could be improved. Native Hawaiians are the ethnic minority experiencing numerous health disparities that emerged as a result of Western colonization. When Hawaii was acquired by the U.S., traditional agricultural practices were substituted by industrial ones. Thus, the local people experienced shifted lifestyles and discrimination in educational, employment, and healthcare spheres. Many Native Hawaiians left the island, but those who stayed did not receive the appropriate medical treatment as practitioners did not possess sufficient cultural competencies and language skills. To improve the health status of Native Hawaiians, a proper care plan should be created based on the health belief model principles and considering the healing practices of local people.